Welcome to my substance use presentation on fentanyl. We'll be discussing fentanyl, the history of abuse, prevalence and epidemiology in the U.S., risk factors in vulnerable populations, short term and long term side effects, signs and symptoms of abuse upon assessment, and potential overdose. And also, we will discuss a care plan. Fentanyl is an illicit manufactured and utilized prescription medication. Similar to morphine, this medication is usually used to treat patients who are in excruciating pain, particularly following surgery. National Institute on Drug Abuse 2021. Patients with persistent pain who are physically tolerant of other opioids may also occasionally be treated with fentanyl. When you require a larger and more frequent dosage of a medicine to achieve the desired effect, you have developed a tolerance. National Institute on Drug and Abuse. Fentanyl functions by attaching itself to the body's opioid receptors, which are located in parts of the brain that regulate emotions and pain, just like the heroin, morphine, and other opiate medications. The brain becomes less sensitive to the opioid after repeated use, making it difficult to experience pleasure from anything other than a drug. Drug use and drug seekers take over a person's life when they develop an addiction. National Institute on Drug and Abuse. It has become more frequent for people to die quickly after consuming fentanyl. Particularly significant contributing elements to the increased risk of overdose death and social repercussions may be its great potency, quick start of action, and endurance of the desired effect. Haynes et al. 2019. One of the main causes of deadly overdoses from cocaine is now fentanyl. Between 2015 and 2017, New York City saw a 55% spike in the numbers of overdose deaths linked to fentanyl. Haynes et al. 2019. Additionally, synthetic opiates are frequently found in illegal heroin, methamphetamines, and fake pill sources. Currently approved and widely used, fentanyl is used to treat postoperative pain, breakthrough pain in cancer patients, and a number of other clinical diseases involving non-cancer pain. However, public health faces a significant challenge due to its abuse potential and the increase in overdose mortality. The earliest record deaths in the United States that were linked to the use of illegal fentanyl were in the early 1980s. The number of fentanyl-related deaths among illegal drug users increased dramatically in 2006. Since then, the number of reported fentanyl-related deaths are more than doubled between 2012 and 2013, and the incidence of opioid-related mortality has steadily climbed. Past or present substance abuse, untreated mental illness, younger age, and social or familial settings that promote uses or risk factors for opioid addiction or misuse. Middle-aged adults with substance abuse and mental health conditions are more likely to die from opioids. Reports of death from poisoning from opioids likely undercut or often misclassify suicides. The risk of suicide in people experiencing pain has to be better understood and evaluated. Short-term and long-term side effects can include muscle and pain, bone pain, sleep problems, diarrhea and vomiting, cold flashes with goosebumps, uncontrolled leg movement, and severe craving. Long-term side effects can cause organ damage, coma, and death. Signs and symptoms of abuse upon assessments. Patients can present behavioral symptoms such as persisting and abusing fentanyl despite the negative effect that it has had directly caused, social disengagement, spending more and more time using and recovering from fentanyl use, speech slur, poor performance or school or job, regular absence from school or work, no longer attending to everyday obligations. Physical symptoms can look like restricted pupils, fatigue and insomnia, psychomotor deficit, and psychomotor state of agitation. Potential for overdose of or use as suicide weapon of choice. Chronic opioid use can increase maladaptive coping behaviors and impair self-regulation, which can raise the risk of suicide in persons who are predisposed to risk-taking and impulsive behavior. Rizek et al. 2021. Chronic opioid use can also neurobiological alterations that heighten negative emotional states, which in turn raises the risk of suicide and encourage ongoing opioid use. Rizik et al. 2021. There is little research on pharmaceutical and psychological therapies for co-occurring AOUD and suicidal ideation and behaviors, despite the fact that people with OUD have a remarkably increased risk for suicide. Rizik et al. 2021. The care plan would include pharmacological treatment such as methadone, buprenorphine, and naltrexone, non-pharmacological treatment, cognitive behavior therapy, and motivational interview. The care plan will also include patient education. Patients need to understand the signs and symptoms of withdrawal, any life-saving medication that can help with overdose, where to seek medical help, and also create a safety plan. Patients can also be referred to inpatient, outpatient rehab, detox centers, and aftercare, and also mental health help. They can follow up with a mental health provider in 30 days after any inpatient stay, and also they can follow up in 2 weeks with mental health providers to monitor treatment progress. In conclusion, we discussed the significant role that fentanyl plays in the opiate epidemic. It is much more powerful anesthetic and analgesic. We also covered its history of abuse, its prevalence in the United States, and the risk factors associated with both short-term and long-term side effects of fentanyl. Additionally, we examined the potential symptoms of abuse and the risk of overdose associated with misuse. Finally, we created a care plan that offers patients various options for treatment, including both pharmacological and non-pharmacological approaches. We also provided education referrals and follow-up resources to ensure comprehensive care.